A shooting at a VA hospital in Florida leaves 6 people, including a doctor, injured. Dozens of people were hospitalized in Alabama after a dangerous chemical spill, and a University of Louisville professor takes a look at what happened to Vietnam after American troops left.
Dedicated to Eastern and Southern Kentucky, this is WYMT Mountain News This Morning.
Good morning. It is 6:32 on this Thursday. It's February 28th. I am Will Puckett, and you are tuned into Mountain News This Morning, and we appreciate it. Well, Brandon's tracking a little bit of rain in the forecast today, but it won't last for long until Sunday. But hey, so at least it's not the stretches of days like we've seen the past month or so, Brandon.
And one day at a time. Let's take it one day at a time as we head in. A lot of things change between now and Sunday, but let's take a look at the cameras this morning, starting with Pikeville Medical Center. And you can see over downtown Pikeville, daylight trying to start to break there on the mountaintop. But again, a beautiful start to the day in Pikeville, just a little bit cloudy. We come back to Whitesburg this morning, and you can see a little daylight there as well. So again, just cloudy skies to greet you as you head out the door. You see some moisture off to our west, back toward Louisville in the form of wintry precipitation, but the colder air that's out that way has not got to us just yet. The cold front draped across the mountains, and you can see it here. 35 in Louisville, but 46 in Wise, 50 in Harlan, and the only spots in the 30s in our region up toward Moorhead and Ashland and Logan at 36, 35, and 39 respectively. As cool as it is this morning, it is still 18 degrees warmer than it was yesterday in Harlan, 14 in Williamsburg and Middlesboro, 12 in London, and single digits warmer than it was yesterday in a lot of areas in the east. 47 this afternoon. We'll bounce down to right around 40 by about 9 o'clock and then start to rebound. Those chances for rain pickup as we head deeper into the day and should start to taper off a little bit overnight. I'll have the rest of the forecast coming up here in a few minutes. Will?
All righty, Brandon, thank you. Well, for more than a year, we have been bringing you extensive coverage of Kentucky's hepatitis A outbreak. Now, we're taking a deeper look at a different disease, hepatitis C. Hep A cannot be transmitted through blood, and its symptoms show up quickly. However, hepatitis C is an infection spread by dirty needles. It gets into your blood and infects the liver. Hep C patients won't see symptoms for years. Miranda Combs tells us how UK's emergency room is able to find the infection before it hits.
Propped at the end of a hospital bed is Dr. Daniel Moore's baby. He's been caring for these charts and graphs since July.
But we haven't objectively seen it come back down in any capacity.
Dr. Moore is referring to the number of patients with opioid-related problems who come through the UK ER doors.
I disagree with people who say that we're at the peaks. Opioid-related visits in the last 3 years have gone up 2,000%.
So, if those numbers are still drastically rising, just like a tidal wave, think of the mess it's going to leave behind.
Injection drug use and hepatitis C were closely related to one another, and that this young second wave of people with hepatitis C are primarily from those doing injection drugs.
Hepatitis C is a chronic infection that may not show symptoms in the body for years, but it leads to cirrhosis and infects your liver. Right now, there are about 3.5 million people infected with Hep C in the U.S. Most don't know they have it.
What we do in the emergency department, we are doing something called non-targeted screening of all of our emergency department patients that walk through the door.
Why?
Because of the opioid epidemic. We have known from other literature that a large proportion of our patients are infected with hepatitis C and don't know it. And what we have been doing is testing everyone who walks through the door unless they opt out.
And the results?
Overall, 11% of all the patients that come through our emergency department are positive for having been infected with hepatitis C.
The percentage was worse for patients in their 20s and 30s. 20% for non-baby boomers tested positive for having antibodies ready to fight Hep C.
This disease that we know is going to cost billions of dollars of healthcare costs downstream if it remains untreated.
Dr. Moore says the treatment for Hep C is now very tolerable for patients, and most of those who get the treatment are cured. But you want to hear the sad part?
Of all these patients we've identified, only 1 in 4 we've been able to get into an appointment so far.
This testing is being done through a grant. Dr. Moore says even if they can't get a grant again, they'll find more money to keep testing, because the more that know, the less the stigma.
The prevalence is huge. We have a cure, but trying to get the cure to the people that have the disease is a huge challenge.
Miranda Combs, WYMT Mountain News.
Now, police and the FBI are investigating a shooting at a VA medical center in West Palm Beach, Florida, Wednesday. According to the South Florida Sun-Sentinel, employees say as many as 6 from people were shot, including a doctor. It happened in the hospital's emergency room. The doctor was shot in either the head or neck by a person in a wheelchair. The doctor was taken to a nearby hospital for surgery. He is expected to survive. According to local media, a suspect was detained and a weapon located. Meanwhile, at least 50 people were hospitalized after a chemical leak at a water treatment plant in Birmingham, Alabama. Officials say chlorine gas was released into the air after an industrial mishap on Wednesday. Birmingham Water Works says this scene was a result of the chemicals sodium hypochlorite and ferric sulfate being mixed together. Originally, 15 people working at the site were taken to area hospitals, and 35 to 40 more were taken for what first responders describe as a precautionary measure. Well, police officers and first responders lined up along Interstate 75, paying respects to a fallen Chattanooga officer who was killed in the line of duty Saturday. WYMT's Hannah Reynolds talked to officers along the procession.
First responders through 3 states stand together.
Officer that was killed in line of duty in Chattanooga, he's originally from Ohio.
To pay respects for Chattanooga police officer Nicholas Gallinger.
And they're bringing his body back through here back to Ohio. We feel honored to give respect to our brothers. I mean, you know, they're police officers, we're firefighters, but we're all one big kinship.
It doesn't have to be somebody from your agency or a neighboring agency. You know, law enforcement is a pretty tight-knit family nationwide.
Police Chief Wayne Bird says Gallinger was killed in a DUI hit and run while on duty, something that happens too often.
21 officers since January have already been killed in the line of duty, and that's way too many officers.
But police say they are thankful they can say thank you to Gallinger for his service before he is laid to rest.
It's not too often that we have a fallen officer that you know, they're transporting up the interstate. So it's a privilege for us to be out here to pay our respects.
Paying their respects as Gallinger goes home. In Whitley County, Hannah Reynolds, WYMT Mountain News.
Now, Officer Gallinger's funeral will be on Friday at 11 a.m. in Cincinnati, Ohio at T.P. White Funeral Home. Well, President Trump is on his way back home after a 2-day summit with Kim Jong-un in Vietnam. CBS's Stephen Portnoy is in Hanoi with details about what the two leaders did not accomplish.
I'm never afraid to walk from a deal.
President Trump wrapped up his summit with Kim Jong-un earlier than expected. A joint agreement, which the White House press office said would be signed, never materialized.
Basically, they wanted the sanctions lifted in their entirety, and we couldn't do that. They were willing to denuke a large portion of the areas that we wanted, but we couldn't give up all of the sanctions for that.
The summit featured extraordinary exchanges between the North Korean dictator and the American press. Kim was asked by one journalist if he's ready to denuclearize.
If I'm not willing to do that, I won't be here right now.
That's a good answer. Wow, that might be the best answer you've ever heard.
Throughout the summit, President Trump has stressed he's in no rush as they try to make the right deal.
Speed is not that important to me. I very much appreciate no testing of nuclear rockets, missiles, any of it.
The top U.S. goal has been to receive concrete steps from the North to dismantle its nuclear program. North Korea seeks relief from economic sanctions.
He has a certain vision, and it's not exactly our vision, but it's a lot closer than it was a year ago.
It certainly was surprising to see the North Korean dictator take questions from the American press. The president at one point admonished reporters to not raise their voices with Chairman Kim. One journalist asked if the North Koreans might be willing to accept a U.S. office in Pyongyang for American diplomats. Both Chairman Kim and President Trump said they'd be open to the idea. Stephen Portnoy, CBS News, Hanoi.
Now, President Trump said he and Kim have not agreed to another summit yet. Now, when the president leaves Vietnam, he will be taking with him an experience that did not exist a couple of decades ago. Luxury and comfort are relatively new to a country that is modernizing at a rapid rate. Dr. Arnold Schechter is a professor at the University of Louisville. He spends most of his life studying the effects of the Vietnam War after troops left. He says President Trump will be living in luxury during his time in the communist country.
Feel very much at home, as though he's living in New York City in the most affluent areas.
Now, since the late 1970s, Dr. Arnold Schechter has logged between 30 and 40 trips to Vietnam, collecting data and blood samples for public health studies. Well, at 6:42, let's send it on over to Brandon on this Friday Eve.
That's right. The forecast this morning, dry for now, but some rain chances come into play a little bit later today. US 119 on top of Whitesburg Pine Mountain. All quiet as we start your day. Buffalo Mountain here in Perry County. You can see the clouds as daylight starts to break there across the region, and they're not going anywhere anytime today. 47 in Hazard, 45 in London, but you see behind the cold front, we're at 31 in Owensboro, 35 in Louisville, 33 in Cincinnati, and 36 in Huntington, West Virginia. So a normal day, not quite as cold as it could be. We have to get closer to freezing to get that little extra on there on the coffee meter. But as you plan out your day, temperatures will actually not get to their lowest until about 9 o'clock this morning, then start to trend upward with some chances for some scattered showers a little bit later on. Will?
All righty, Brandon, thank you. Well, we will have stories trending on WYMT.com next. As always, thank you for joining us right here on Mountain News this morning.